I'm also a patient living with a rare disease, and so I understand what it's like to go through a diagnostic odyssey and to spend 17 years looking for answers and finally find them. And I know that we're not defined by the rare diseases that we have, but they do affect us. They affect us every breath, every step, every thought. And it's so important for us to come together to find ways in which we can move things on and ensure that all of us, regardless of the way in which we are affected by a rare disease, we come together to find solutions. It's all about finding solutions. EURODIS was founded in 1997 by patients across borders in various different countries across Europe with different jurisdictions, different types of centralised systems, decentralised systems, small countries, large countries, but all had the same need, the same fight, the same will to make a change. And a lot of them had that will to make a change through research. And it's interesting, just in your remarks earlier, to talk about fighting blindness. Fighting blindness actually had its birthday this week. We were 31 on the 25th of February. And that organisation was founded by patients who had a diagnosis of a rare inherited forms of blindness, getting together for support. They'd heard about genetic research that was happening in the United States, and they fundraised, they set up a project in Trinity College in Dublin, and that project found the first gene responsible for a condition called RP. Little did they know there would be 160 genes identified for this particular type of condition and 200 mutations, so it became a very complex one. But my point is that when they tried to set up a charity, they knew that there was one in the UK, the BRPS, the British RP Society. So they reached across the water, across the border, and the BRPS Society helped them to found their charity. And in fact, Fighting Blindness Ireland in its first stage was the Irish branch of the British RP Society. So we've come a long way, and interestingly now, in the development of the National Register for Inherited Retinopathies, we're reaching back to our colleagues in Northern Ireland and our colleagues in Queens and working together on that. So, it's important to know that from very small acorns, big, important and life-changing circumstances where people can occur. We meet a lot of people at events like this. In fact, this is the 5th day of events for some of us. And the questions are the same. For people who are new here today, your questions are the same. You're not alone. We've all been through the stage of what do I do, where do I go, who do I speak to? And the people are in the room. There is progress being made. Regardless of the condition that you have, please come and talk to us. We're there to help, we're there to support, and hopefully you can help to support us too. And that's really very, very important. So actually, my actual job here today is to chair the session, so I suppose I should really get on with that. We have 3 very distinguished panellists, and I'm going to introduce them probably just one by one. And our first speaker is Katie Murphy.
Firstly, I'd like to thank you for asking me to be here today. I'm absolutely delighted to take part in Rare Diseases Day, and as Avril has pointed out, I am a person with cystic fibrosis, so rare diseases is something I'm very passionate about. So as Avril again said, that I am the Research and Development Officer with CF Ireland, and my background really is research and academic based. So since joining CF Ireland, I really became very passionate about patients being involved in research and in policy development, and I think for this reason, this is why the draft of the Irish Rare Diseases Plan is so strong. It was patient representatives who really were at the core of its development, and I think wrote quite a large portion of it. And I think that will really translate very well into practice, because it's all well and good to write these policies, but you need to implement them very practically and as practically as possible in these days, I suppose. These are kind of the same things, but to kind of talk about what I think the next steps forward should be, and I'm going to kind of give cystic fibrosis as an example, because CF is a rare disease, but as we all know, it's developed very significantly since CF Ireland was founded in 1963, so it's 51 years old. It's one of the oldest patient organisations in Ireland, and through a lot of hard work and years of dedication, it has really improved dramatically in the space of that time. But I suppose it's important to remember that we are still a long way off international standards. But So living with cystic fibrosis, it is a constant challenge, and it has to be managed personally to a large extent, but also the health system plays a very, very crucial role in managing this illness and increasing life expectancy and, most importantly, quality of life for everybody who's living with the illness. And I think it's important to note that there have been a lot of key developments, and what they have directly contributed to improving my quality of life and for many other people with CF, and also just improving the health and medical care that's being received by people with CF throughout Ireland, and also in the UK. The CF Trust, which is the UK's advocacy body, have always worked very much hand in hand with CF Ireland, and thankfully both jurisdictions have seen the progress that has been made over the 50 years that we've been established. So this brings me quite on to one of the most important things is having a national office, and the importance of it simply can't be underestimated. So as I said, we were established 50 years ago, and I think since it's been established, the key goals of CF Ireland have been lobbying and fundraising for improved provision of safe treatment facilities for people with CF. And again, this was also carried out in the CF Trust. And some more crucial roles CF Ireland play is improving the quality of life for people with CF, provision of information and services, grant supports, and often something which maybe isn't recognised enough, it's having providing support for families and people living with the illness. So people being at the end of the phone for any questions or for even a chat. And the fact that there isn't a national office for many rare diseases in Ireland and in Northern Ireland, I think this is a huge gap, and that families don't really have that phone number that they can just pick up and have a chat and ask questions and find out information. So it really is quite unjust that there are many people living with very serious illnesses and that they don't have that support already. And another area which I would believe to be very important is the need for patient registries. These are crucial to planning the delivery and the review of healthcare in Ireland, and they provide data and analysis to observe the trends and course of disease, to inform clinical policy development and at national and international levels. They also provide access to clinical outcomes, so for effectiveness and safety. They explore the impact of the disease and treatments on patients, including health-related quality of life and other patient-reported outcomes. And they can also assess health economic inputs, outcomes and impact. So the value of the Cystic Fibrosis Registry of Ireland has been really immense. Without the registry, we wouldn't have known that Ireland has the highest rate of CF in the world. We wouldn't have known the carrier rates for people, so 1 in 19 people in Ireland carry the gene for cystic fibrosis. We wouldn't have been invited to take part in some of the most innovative and impressive clinical trials, I suppose, in the history of CF, knowing that the different genetic mutations that people have with CF, I suppose the registry could very clearly illustrate that we had the genetic mutation G551D, where there was a new innovative drug that was developed called Kalydeco. And if we didn't have that information, I don't think Ireland would have been chosen as a site for the research trials to be carried out. So having the registry really has impacted very, very significantly, and it's also been able to inform us on, map patient outcomes, see how trends are going, looking at age, mortality rates. Without the registry, we wouldn't really know whether outcomes are improving for people with CF, and also can monitor hospitalisation rates. So I think it's kind of as I said, it's the combination of the national office and our CF registry that has really encouraged clinical trials to come to Ireland, and it's also really helped raise a lot of national awareness about CF across Ireland and again across the UK as well, because once you have the information and the advocacy force behind you, you can really create a lot of national awareness, and I think it's something that rare diseases really need to do quite strongly, because they're often very powerful stories and very powerful patients who have a lot to say, but if they don't have the backing and the encouragement to go forward, it can be very difficult to achieve this. And it can also, when public awareness is raised, it can also encourage understanding, compassion and acceptance for people living with rare diseases, and also for their families. And again, the improvement in diagnosis and treatment, again, through the work of national offices and registries, we were able to advocate for CF to be included on the HEAL prick test. So this meant that people were going to be diagnosed from birth, and there weren't going to be long delays in being diagnosed. I myself wasn't diagnosed till I was about nearly 4, and my brother was 7. So there was a long period of time where there was permanent damage being done, and had the Hebert test been introduced, that would have been prevented. And again, this is something for particularly genetic conditions. National offices need to advocate for these to be included on the Hebert test. And all people really living with a rare disease, they need to be heard and absolutely need to be given the best treatment possible in both Ireland and Northern Ireland and across the UK. And again, just finally, I think, as I mentioned, you know, it's very important to have the medical care there, but I don't think we can underestimate the need and the importance of having a source of support and advice for both patients and families. It's very difficult if you are having a tough time and you want to find out information, ask a question, even just talk to someone if you're having a bad day. And if you don't have a national office or, you know, people who can be compassionate and understand what you're going through, that can be a very difficult thing. So again, that shouldn't be underestimated, and I think, you know, it's very refreshing to hear Minister White talking about the establishment of a rare diseases office in Ireland, and I think that could really, the establishment of that could kind of cover the 5 areas that I've touched on today. Probably talk for hours about rare diseases, but I'm going to leave it there because I know we're on a tight shift. But I'd also just like to thank all of the organisers again for asking me to speak here today, and to both ministers for attending. I think it's wonderful to have the political support that we clearly do. And to reiterate what Alistair said, you know, that we all need to get behind it. It's a very worthy cause. So thank you very much.